Loratadine tablets prevents the development and facilitates the course of allergic reactions. It has antiallergic, antipruritic, antiexudative action. The antiallergic effect develops after 30 minutes, reaches a maximum after 8 to 12 hours, and lasts 24 hours. It does not affect the central nervous system and is not addictive. Indications: seasonal hay fever and year-round allergic rhinitis, allergic conjunctivitis, elimination of symptoms associated with these diseases, sneezing, itching of the nasal mucosa, rhinorrhea, burning sensation and itching in the eyes, lacrimation, skin diseases of allergic origin, including chronic idiopathic urticaria, allergic reactions to insect bites, pseudo-allergic reactions. How to use: inside, regardless of the meal. Adults, including the elderly and adolescents over 12 years of age, 10 mg 1 tablet 1 time per day. Children from 3 to 12 years old with a body weight of more than 30 kg, 10 mg 1 tablet 1 time per day. With a body weight of less than 30 kg, 5 mg 1 half tablet 1 time per day. Adults and children weighing more than 30 kg with severe hepatic impairment, the initial dose should be 10 mg, 1 tablet every other day. The duration of treatment depends on the duration of the symptoms of the disease. If symptoms disappear, the drug shall be discontinued. If symptoms reappear, the drug shall be resumed. When using the drug in elderly patients and in patients with chronic renal failure, dose adjustment is not required. If after treatment there is no improvement or new symptoms appear, it is necessary to consult a doctor. Contraindications: hypersensitivity to loratadine and other components of the drug, lactose intolerance, lactose deficiency, glucose-galactose malabsorption syndrome, period of breastfeeding, children under 3 years of age and body weight less than 30 kg. Side effects: like all medicines, loratadine can cause side effects, although not everyone gets them. Drowsiness, headache, increased appetite, sleep disturbance,